Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we'll be seeing about pediatric nutritional assessment. So when we consider about the nutrition, it is one of the very important key factor which aids in the improvement of growth and development in the children. So a growth is a measurable term, that is a quantitative term that can be measured by kgs or pounds like that, and also we can measure it by centimeters, the height if you are measuring means. So when we are providing a proper nutrition, the child will attain a normal growth and development. Have to assess the nutrition pattern of the child means it also depends upon either it is a deficient of nutrition or over toxicity of the nutrition. So if there is a deficient of nutrition, they may end up with malnutrition, and in the same way if they are having over nutrition, that comes as a obesity. So only we have to consider both the aspects of nutrition. So once we are providing a proper nutrition only, the baby will have an accelerated growth. So only when a baby is born, we are initiating breastfeeding. So breast milk, it is a nutritional package which contains an abundant amount of antibodies and IgA factors and proteins, fats, minerals, and everything is present in that breast milk. And the same way, when a baby attains a 6 month of age, you will initiate as a nurses, you will encourage the mother to have a weaning food, that is from 6 month of age onwards, along with the breast milk. So why we are considered these all to a newborn or an infant means, once we are providing a proper nutrition only, the major health drawbacks can be minimized, like protein, energy, malnutrition and everything. So if we are seeing about the nutrition pattern of the child, you can see various kinds of infants or toddlers will exhibit different kinds of reaction. Some will be very happy while having feed, and some will be refusing to have a feed, even a single spoon, and some children will be exploring by themselves when they are sitting on the high chair, and they will explore by themselves and they will enjoy eating the fruits and vegetables and hand picked foods like that. So we'll see one by one in detail about the nutrition assessment. So first, introduction. A nutritional status of an individual is often a result of many interrelated factors. It is influenced by adequacy of food intake and also by the physical health of the individual. The assessment of nutritional status involves various techniques and proper evaluation. In simple term, this means that how much amount we are consuming and how the quality of the amount we are consuming. So even everyone eats food, but if we are eating daily a junk food means it is no more useful for our body. So we have to consume a well balanced diet that contains all the nutrients from micronutrients to macronutrients, that is as per the recommended dietary allowances. So once we are consuming the food according to the recommended dietary allowances, that is according to the age group and also the cultural backgrounds, everything, then what happens, the baby will attain an accelerated growth. So we'll see the definition. Nutritional assessment is defined as assess the adequacy of food intake both in terms of quantity and quality, and also by the physical health of the individual. So we can do the nutrition assessment by examining their quantity and quality of the food intake and also by the physical health of the individual. So how we can assess the physical health of the individual? By measuring their anthropometric measurements from head circumference, from chest circumference, mid-arm circumference, everything like height and weight. Next is indicators of nutritional assessment. To whom and all will do the nutrition assessment is, one is nutritional history, appetite. By doing the nutrition history, we come to know that there is a lack of any vitamins or minerals. So we are going to do the nutritional assessment. Next is appetite. If they have altered appetite, that is loss of appetite, if they are not feeling any hungry at all, we will do the nutrition assessment. Next is nausea or vomiting more than 3 days. Diarrhea, dysphagia, that is difficulty while swallowing, reduced food intake, that is less than 50% of normal for 5 days. Next is diet restrictions. If while doing history collection, if I come to know any patient is doing any diet restrictions, also we have to do the nutrition assessment. Next is unintentional weight loss. Without any reason, if there is a weight loss, we have to do nutrition assessment. So the next is assessment method. In which method we can do is, there is ABCDEFG. So up to dietary history we will see in this video. That is, A is for anthropometric measurement, B for biochemical examination, C for clinical examination, D for dietary history, E for ecological history, F for functional assessment, and G for general assessment. So this is in simple term how we have to assess the nutrition status in a child. So anthropometric measurement means you are going to check all their height, weight, everything. We will see one by one in detail. So first is anthropometry. It is inexpensive, non-invasive and easy to obtain, valuable with other parameters. So here in anthropometry we are going to check the height of the child, weight of the child, skin fold thickness of the child, mid-arm circumferences, head circumferences and chest circumferences. So mid-arm circumferences is assessed by measuring from acromion process to oligron process. We will measure it. In that, when there is a half, we will just round among that part and we'll check the mid-arm circumference. By checking these all anthropometric measurement, we will apply it on the degree of malnutrition formula. That is actual weight by expected weight into 100. So actual weight is what the baby is having exactly weight when we are measuring on the weighing machine, and expected weight is by employing the formulas for each and every age group. There is a expected weight formula. So based on that, if you are applying that formula, you will come to know the value in percentage. Then in that percentage we will categorize the children's according to the malnutrition. So here we will be seeing about the Gomes classification. If a child falls between 75 to 90% expected for the age, they come under grade 1 malnutrition. If they are coming from 61 to 75, it is a grade 2 malnutrition, and less than 60 or equal to 60, it is a grade 3 malnutrition. So by applying it on the degree of malnutrition formula, we will come to know the percentage, and that percentage will be correlated with the Gomes classification. Next is biochemical evaluation. So first in ABCD we have A is over. Next is biochemical evaluation. So every disease condition have their own biochemical evaluation. That is, if I am having anemia, means my hemoglobin content will be very less. It will be altered. And also when I do my blood test, that process is known as biochemical evaluation. So not only for anemia, for each and every diseases we will exhibit by obtaining their blood sample, will come to know what deficiency they are having. So for example, we can say that, so measurement of the nutrient concentration in the body, example serum retinol or serum iron. So detection of abnormal metabolites in urine, that is urinary iodine. And in the same way, we can check riboflavin deficiency can also be detected. So in this evaluation of the blood component, you will also assess for the protein level, albumin level, C-reactive protein level, creatinine index, hematological indices and nitrogen balance. So these all about the laboratory investigation, that is biochemical evaluation. In terms, we are going to check these all values in the blood, and by assessing their biochemical examination, we will correlate with the patient. Next is clinical examination. So among ABCD, A is over, B is over, C is clinical examination. So clinical examination means if any child is having any disease condition or any malnutrition or deficiency of the nutrient, that will be exhibited in their physical symptoms. So that is known as clinical examination. So when as a nurse I am going to do the head to toe examination, I will come to know these all are the symptoms present in the child, and that signs and symptoms is related to this disease. For example, I am having a severe anemia. So what all clinical symptoms I will have is, like, my hair will be easily pluckable and nails will be very brittle. I have a pale conjunctiva, and I will be having like a coated tongues, and when the capillary refill will be not less than 2 seconds, like that they'll be having various signs and symptoms. So now I have said only for the anemia. In the same way, each and every disease condition have their own clinical examination. So by assessing the each and every body organs from the head to toe, we'll come to know that what disease condition the child is mainly having. So when we are assessing the head to toe assessment, so like eyes, if you are finding the conjunctiva, if it is very dry, wrinkled, or if there is any bite out spot like black spot will be there, then brown pigmentation is there, or angular conjunctivitis is there, or whether the baby is having pale conjunctiva, or we will all for the cornea for dryness, hazy or opaque. So if there is no any tear and all, that means they are having a dryness of cornea. If there is so much of excessive tears from the, it is known as opaque. So that is a, and also in lips we can see that angular stomatitis. If there is a vitamin deficiency, we can go with angular stomatitis, chelosis. In tongue, that will be pale in color, flabby, red and raw fissured. So the tongue will not be in a pinkish in color, so there will be any coated present in the tongues. So when we consider from the head to toe, each and every body parts will exhibit some of the symptoms. So in teeth, they will be having a mottled enamel, the baby may have dental caries, and distribution will not be equal. The gums will be spongy and bleeding, like that. If it is skin, means it will be either we have to check for dryness, scaly, pellagra, and nails means coiloncuous. That means the nails will be in a spoon shaped. So normally we will be having a curve shape, right? But whereas in coiloncuous we will be having a spoon shaped nails. So that is one of the symptoms that is mainly caused due to various disease conditions, associated symptoms. Next, in edema, we will see in all over the part of the body, whether it is a pitting edema or non-pitting edema. Then then muscular changes like knock knee, bow legs, epiphyseal enlargement, beading of ribs, pigeon chest. So when we have a vitamin D deficiency or calcium deficiency, the child may have a knock knees, bow legs, like they will not be able to stand erect, and their gait will be altered. They will have a bending of the legs. Next is internal system. So hepatomegaly. So when we do the palpation, we come to know the liver is being when the liver is being palpable, it is known as hepatomegaly. Psychomotor changes will be there. The child may have sometimes memory losses, mental confusion, motor weakness. Next is loss of ankle and knee jerks, everything. Then is dietary history. Dietary history, we will be assessing their appetite and intake level. So we'll ask for the history, like do you have any taste changes? Do you have any metallic taste in your tongue? Do your dentition is normal distributed? Do you have any dysphagia, that is difficulty while swallowing? So do you take your feed by your own, or you are being fed up by your caregivers? And do you take any vitamin or mineral supplement? Like that we will ask from the children as well as the caregiver regarding the dietary history. So in dietary history, mainly we will be checking their calories level, fats level, carbohydrates level, everything. So by assessing their levels, we will correlate it with the recommended dietary allowance. So that is the dietary history. Next is eating pattern. So we will ask the history regarding the daily food habits and weekend, how you are going to alter your nutrition pattern. Next is we'll ask about, do you have any diet restrictions? Next is ethnicity. Do you follow any ethnicity? Or eating away from home. Do you take the food in the home, or do you take food from outside the world, outside home? Or do you have fat diets? Or like dietary restrictions, like in some religions, they don't take onion, garlic, or any fish. So the nutrient which is present in that particular food will be lacking for the person who is skipping those food items. So for example, if someone is not taking fish, means the omega-3 fatty acid that is present in the fish, that is an abundant amount, will be lacking for the person who is skipping those fishes. So next we will be seeing about the 24 hours dietary recall. So for 24 hours dietary recall, you have to assess the food frequency, how often the child is eating, that is 3 times per day or 4 times per day, like that. Next is we will be asking some of the questions related to 24 hours dietary recall. Next is food diary. Next is observation, how the child is intaking the food in terms of quantity and quality. So 24 hours dietary recall means when I go and do the nutritional assessment for the child, I will be assessing their dietary pattern from the previous day 6 a.m. morning 6 a.m. to today 6 a.m. So 24 hours what and all they have consumed. So then I will take the amount, how much quantity they have consumed, and I will calculate the normal calories, carbohydrate level, protein level, fat level, micronutrients level, like that I will do everything. Then what happens is I will just correlate it with the recommended dietary allowance. So once I correlate with my recommended dietary allowance, I'll come to know whether the child is having a deficient food intake or the calories which is present in the food is it is a deficiency of calories or vitamins is there. So based on that, if there is a deficiency of those calories, I will give a modified dietary pattern. So next is nutritional questions. So what and all we'll ask for a question is like general assessment, usual adult weight, current weight, maximum minimum weights. Next, weight changes from 1 and 5 years prior. So how the weight gain was there from 1 to 5 years, we will ask from the children and also the caregiver, and also the other nutritional questions also will be asked, like recent changes in weight and time period, recent changes in appetite, presence of weakness, fatigue, fever, chills or night sweats, recent changes in sleep habits, daytime sleepiness, next edema or abnormal swelling. That and all will be just noted from the patient, and also the history will be collected. So next one is ecological assessment. So ecological assessment means the history collection. So what all the history we are going to collect it from the patient, that is known as ecological assessment. So far we have seen about anthropometric measurement, A, B, biochemical evaluation, C, clinical examination, D, dietary pattern, E is ecological assessment. So F is functional assessment, G is general assessment. So F and G will not be dealt here, we will see only up to ecological assessment. So we will be assessing their medical history like diagnosis, past medical history, surgical history, medications, and psychosocial status like economical status, occupation, what is their education level, what they are doing for their living, like that. Now others is like you will ask about their age, sex, level of physical activity, do they follow any sedentary lifestyles, and activities of daily living, how they are following, like that. Next is warning signs of poor nutrition status. So if they have any disease condition, obviously they will be having a reduced food intake. So that is one of the warning sign of nutrition status. Next is poor eating pattern, a tooth loss or any mouth pain, economic hardship, reduced social contact, multiple medication if a child is taking, involuntary weight loss or gain. That means without any reason, without any intention, the weight will be reducing. Either reducing or weight gain will be there. Next is a need for assistance in self-care. So even for doing our basic need self-care, we need assistance due to the obesity or due to the malnutrition. So if we are having any malnutrition or over obesity in the child, we have to give them a modified dietary pattern. So once we are giving the modified dietary pattern, we have to do the proper follow-up. So modified dietary pattern in the sense that should correlate with the recommended dietary allowances. That is, if the child is going to a toddler, means we have to check the recommended dietary allowance of toddler. So how much kilocalorie has to be taken, how much protein has to be taken, how much fat has to be taken, how much micronutrients and macronutrients has to be taken, like that we have to correlate with the recommended dietary allowance. Then we have to prepare a modified dietary pattern. Again we have to correlate it with the RDA. Then we have to give it to the patient the modified diet. So even in hospitals and all, they will be giving some pamphlet regarding diabetic diet, like that. No, that is in simple term. So far we have seen about what is the nutrition assessment, what are the methods of nutrition assessment, that is ABCDEFG. Then what are the ways to overcome the nutritional deficiency. So if you have any doubt, kindly drop down in the comment box. Kindly like it, share it and subscribe it. Thank you for watching.